So today we're going to be talking about some questions that they asked in an interview. We already said that the questions are divided into different segments, talking about your professionalism, your interests, tell me about yourself, why the specialty. There's a part of the interview that focuses on your personality, personal traits, and how you function as a person. So I'm going to be asking a few questions. My name is Kobe Edwards. I'm the pioneer of IMG Research Academy, and in IMG Research Academy, we prepare residents and fellows and people who are going into interview to be confident presenting. Many of us are foreign trained physicians, so we're struggling uphill tasks against our accents, against our word choices, against pronouncing words clearly, and then confidence, and then cultural adaptability. So these trainings, we go through the different things, components of how we're going to present, and components of how we're going to deliver our question. So one of the questions that they ask numerous questions like, tell me about your strength, your weakness, what will you do in this? What character describes you? If you're a tree, how will you describe yourself? And so many things that they ask. In medicine, they ask this common question. So I'll ask you, Dr. Abaoba. Dr. Abaoba has given us permission to share this video. And then we go from there. Dr. Abaoba, tell me about your strengths.
Thank you for that question. I'm happy to share that with you. I would say one great strength that I have is resilience. My ability to keep pushing, even if I face difficulties. And that has helped me with my patient care. I don't give up on outcome for my patients. I make sure my patients get better over time. And, it's this resilience that helped me. Also, that has helped me in personal issues as well. For example, with my board exam, I was able to strategize, work harder, and that really brings a great outcome from outcome results from it.
Awesome. I think that was a great response, and you hit the nail on the head, and I really like it. It was concise and short and straightforward. A few missing parts that we're going to blend together. But before we blend together, we're going to do like 10 minutes teaching so that you can broaden your scope.
All right.
One of the questions, when they ask that question, tell me your strengths. We as an academy think that the people that ask those questions, or the program directors or the program that ask those questions, they are looking for, what are you bringing to the table? What is your strength that can help my program either grow or be strong, or what are you bringing to the team? So your answers are perfect. We kind of recommend people to use the hydra-headed approach. That's the octopus approach, I call it. Octopus, the head, the big head of the octopus, and then the fimbriae, or the hand, or the arm, whatever they call it. Now, the big head is the strength that you're bringing. And then with the strength you're bringing, you're going to use it to describe how it makes you a good resident in the various components, the core competencies of what a resident should be: patient care, communication, interpersonality, professionalism, patient safety, professional development, system-based practice, working as a team, medical knowledge, cultural competency. Those are the key things, right, that a resident should have. That's the ideal things, plus other things, right? So when you're addressing your key strength, you try to at least pick three or four of them, or two or three of them, talk within 2 minutes, like you just answered a question that addresses one of those things. For example, like what you just said, my key characteristic, one of my major strengths is resilience. And I think that resilience, my ability, you define it a little bit, my ability to endure even in the face of difficulties and then produce result. And that has really helped me in various aspects of my life. For example, so when for example, you're using transition phrases. For example, my patient care, right? I don't easily give up. I take my time to, get the details from the patients, go the extra mile. Let's say patients that are having that is having difficulty in coming to a conclusion about their diagnosis. I go the extra mile, call the attending, consult guidelines, talk to other seniors that are more experienced to see how we can come together to make a diagnosis. I go the extra mile to, for example, lots to follow up patients, to follow them up. Patients that were discharging, we don't just discharge them, we follow them up. Patients that may have forgotten their past medical history, I request for the medical record. Patients that must have forgotten their medications. I call the pharmacies that they use to see how I can get. So you're not going to say all this and just pick one or two, right? Like for your own, you picked, getting details from your patient. Now that resilience also helps me to withstand the pressure of the day. I don't crack, even if I have 10 to 15 or 10 to 20 patient load or patient panel, I don't crack easily. I take my time focusing on each one of them as a unique entity and going through making sure that I give them the best evidence-based care management. And then you move to the next one. Also, another thing that resilience does for me is it helps me to function well as a team. I bring in that inspirational spirit, that resilient spirit to fortify my team in areas they may be weak. Let's say somebody's calling off, somebody is not competent in managing an aspect of the disease or a particular patient panel or functioning in a particular capacity. I fill up the gap, right? And then you talk about your story. If there's anything in your personal story resilience has helped you do. For example, that resilience has helped me to overcome the challenges I faced during my board exam preparation for my board exams. I had to study extra hard to make sure that the areas I had attempts, I overcame them and I became better, coming out better. I think overall that resilience also helps me to meet deadlines. I know that when I get home, I need to prepare for the next day. I need to prepare for conferences that are upcoming. I need to prepare for presentations. I need to understand the systems that I'm going to use in the following block or the following clinic. So above all, then you say 3 or 4. We're going to say like 10. How resilience helps you with system practice, how it helps you with managing difficult patient, how it helps you with communication, right? I don't allow communication gaps. I respond to emails on time. I'm timely, prompt and concise in what I say. How it helps you with, let's even begin to figure out other key components of a good residence, right? We mentioned so many of them. And then how it helps you to study, because you need some degree of resilience to be able to burn the midnight candle, right? We all get tired at home, but I need to read. I'm that kind of a patient I'm that kind of a doctor that looks up my patient, the patients that I'm going to see tomorrow, next week, so that I can prepare for them. But I know that when I get tired, when I get home, people get tired, but that residence kicks in. I open up my patient panel for the following day and I read about them so that I can prepare on time when I want to see them. Above all, it helps you to achieve tremendous results, and I'm happy where it is. And then you close. The closing now will now be to stop. And I hope to bring in this resilience into your residency program, right? And become an effective part of the team. And then there are different types of closure. This is mine. You could say yours, and I hope to bring in this resilience. And I hope this resilience component of me, this resilience aspect of me, will keep pushing me through, my career, or make me an effective resident when I join the program, or however you want to close it, right? So that's the approach we recommend. There are various approaches out there to answer that question. Tell me your strength. We'll prefer the octopus approach. That's, you mention the one thing and then you branch out. Now you're not going to branch out into too many, because the reason why I'm branching out into these too many is because I'm doing these teaching sessions, right? These practice sessions. You just got to pick 3 so that you talk within 2 minutes. The 3 key ones, and the 3 key ones I usually talk about is patient care, patient safety, ability to work as a team. No, those are the common things that a program would kind of look up for somebody that they want to take. They want to see, are you resilient in managing patients? Are you good? Are you competent? Are you knowledgeable? Right? Can you function as a team? Are you that kind of lazy person, laid back, heavy feet dragging, or you are that, oh, let's do it kind of a person, all right, bringing that spirit of energizing inspiring and energizing your team? Are you someone that will going to listen to the program leadership, or are you that kind of person that comes with a very critical mind? So that's our approach. And thank you, Dr. Aboba, for giving that response. We're going to stop the recording now. This is IMG Research Academy. In IMG Research Academy, we talk all things research, and then recently we started talking about helping ourselves on how we can move to the next career in a medical trajectory. Majority of us are physicians. We do paid consulting one-on-one interview preparations just like this, where we sit with you and then we make sure that we build your, not only your speech content, your confidence and your delivery, and then the content of what you want to say to make you become effective, to make you become successful in your interview program. Phone numbers are 240-360-8444 and our emails are on our website. Thank you so much and God bless.